Now we're looking at what is known as the withdrawal reflex in patients. So withdrawal reflexes, right? It's not just one reflex. It's many types of reflexes. So we're basically trying to describe them and talk about the different examples of these reflexes that we collectively say they are withdrawal reflexes. So withdrawal reflexes in patients just have to do it. You touch them and that part of the body comes like moves back. Okay, the part of the body kind of like moves back. Okay, so withdrawal reflex is also called flexor reflex. It's a protective and involuntary response of the body to anything that is painful or anything that seems harmless and harmful. Okay, so use it in patient because you want to know what, of course, is a type of process that is actually what is mediated by nerve action. So you're now using it to access how the nerves are still functioning and all of that. So mechanism, a painful stimulus like all those prick and heat usually applied to the skin. So how your nerves react will now be what will make you go away or still keep it. Do you understand? So the pathway, sensory neurons are supposed to actually carry that signal to the spinal cord. Interneurons in the spinal cord are supposed to what? Please, you can pause to observe this. This is a whole process that we're trying to talk about. Number one, number two, all of that. Okay, so interneurons in the spinal cord will activate the motor neurons. Motor neurons will now stimulate any muscle that is supposed to flex and go away. It will contract and withdraw. Okay, result, the affected limb quickly pulls away from the source of pain. Okay, so clinical significance of this is if there's normal response, you usually see quick withdrawal. If there's absent or reduced reflex, the person will leave it there for a very long time before later on the person is taking it away. Shows you that there's a peripheral neuropathy or spinal cord injury. If there's an exaggerated reflex, the person moves away too much and all of that, So examples in practice include all those pinprick tears, heat stimulus tears, and the hand pulls back immediately from a hot object. So in an overall, it's used for what? All those neurological examinations. So that's very important picture. You can pause to observe it.